Hello everyone, my name is Dr. Neil Jackson. This video is on eardrum and mastoid surgery. This is an introduction for general audiences. So some common ear problems that we tend to encounter are things like having a hole in the eardrum, having frequent ear infections or drainage out of the ear, having a type of hearing loss that we call a conductive hearing loss, or having a spread of infection or growth. And a spread of infection could be mastoiditis, and a growth could be cholesteatoma. These are all things that would require surgery on the eardrum and the mastoid. As I said earlier, I'm Dr. Neil Jackson. I'm an ENT subspecialist of the ear and the skull base, otherwise known as a neurotologist. I'm fellowship trained, I'm double board certified, and I see both adult and pediatric patients. For more information on me and my background, you can check it out on my website at neiljacksonmd.com. One important disclaimer is that this is not medical advice. This really is just content for informational purposes only. For medical advice, of course, you should seek care from your doctor based on your unique situation. And the other disclaimer is that this is more of a general introduction. This is not comprehensive and it may not apply to all possible clinical situations. Okay, so a summary of what we're going to talk about is that eardrum and mastoid problems are really structural problems. And the most common problem that we encounter is a hole in the eardrum, also known as a perforation or perforated eardrum. Other related problems can be damage to the tiny bones of hearing. These bones are also known as the ossicles. And the third thing is infection or inflammation of the mastoid bone, which is the bone behind the ear, and that's referred to as mastoiditis. So the best option for most of these problems is to reconstruct the problematic areas. That's really the best option for most patients. Medicines do have a role, like antibiotics and eardrops, but they have a limited benefit for structural problems. So we do this reconstruction in the operating room. It's done under general anesthesia, so the patient doesn't feel anything, and they can go home the same day. Surgery is successful in most patients, around 90% of the time, and there are alternative options, and everything comes with risks and benefits. Just to maybe review the anatomy of the ear. So most people think of the skin and soft tissue on the side of the head as the ear, but as an ear doctor, I consider all of this area here to be the ear. So in addition to the external ear, we have the ear canal, which leads down to the eardrum. The eardrum is partially removed here so we can see on the inside of it. This is where we call the middle ear space. This is where infections like otitis media happen. And this is where we find the three bones of hearing, which some people know as the hammer, anvil, and stirrup. In medicine, we call them the malleus, the incus, and the stapes. And so all these structures carry the sound waves deeper into the ear. And then that is where the cochlea then detects those sound waves and converts those to an electrical signal that the nerve of hearing then detects and carries on to the brain. So for hearing to happen, all these things must happen correctly and must happen in sequence. So patients who have a problem with the eardrum or the bones of hearing or the mastoid bone, seen here as this honeycomb of bone, they will have a type of hearing loss called a conductive hearing loss, and they'll have infection that may involve the middle ear space behind the eardrum as well as the mastoid bone. The eardrum, like we mentioned, is a very small, delicate sort of window or membrane. The two main functions are that it helps with the hearing, but it's also part of our protective layer of the body. And so it prevents bacteria and water from going deeper inside the body and causing more issues with infections. People who do have eardrum problems typically will complain of things like having hearing loss, having poor hearing, having frequent infections of the ear, and especially after they get liquids like water in the ear, they will often complain of having pain in the ear and then infection for a few days. They may have pain and a bad odor when the ear gets really bad, and they may have drainage, that is like leakage or having like the ear sort of run on them, and sometimes that can be bloody. So these are very, very common symptoms that patients are aware of. And the other thing that we as medical specialists have to consider is that the patient could have something like a growth inside the ear that we call cholesteatoma. It can also present like this with all the same symptoms. So again, when the problem is really a structural problem, like having a hole in the eardrum, the best option is really reconstruction or rebuilding those problematic areas. So whenever we repair or replace any weak or damaged parts, we have a name for that. So whenever we repair a weak eardrum or one that has a hole in it, we call that tympanoplasty. When we clear the mastoid infection out, we call that mastoidectomy. When we repair the bones of hearing, that's called ossicular chain reconstruction. These are all sort of separate procedures, but they can all be done at the same time during one trip to the operating room. Sometimes in ear surgery, we don't quite know the extent of the damage until we get a chance to go inside the ear during surgery. And so oftentimes when I talk to a patient about a surgery like a tympanoplasty, because we know there's a problem with the eardrum, I will often get their permission to also perform a mastoid procedure, like a mastoidectomy, and also an ossicular chain reconstruction procedure at the same time. There are other options to treat ear problems. One option sometimes is to do nothing, and if the problem is mild or if it heals on its own, that's great. Sometimes the doctor can help with doing some ear cleanings in the office. We usually also will add some medicines like antibiotics taken by mouth, as well as antibiotic ear drops that can be put into the ear. And if the problem is really with hearing, then another option is a hearing aid. But the focus of this talk today is really about the surgical options. So tympanoplasty is a procedure to rebuild the eardrum. There's a few basic steps. Essentially what we do is we make cuts or incisions inside the ear in the skin around the eardrum, and we essentially want to roll up that skin, which is attached to the eardrum, roll it up kind of like you roll up a rug until it's folded over on itself, and then we have access to the inside of the eardrum where the bones of hearing are and where infection may be causing problems. That gives us the chance to repair the bones of hearing at the same time, also clear out any infection, and then we want to close the hole. So we'll often take a piece of tissue that we call a graft or a patch, we'll slide it in, and then we'll unfold or unfurl that eardrum that we raised up earlier, lay everything back down, and there should be complete closure or coverage of the hole. How do we do that? There's a few materials that we often use. One that we use often is called fascia. This is the fascia from the muscle behind the ear. This is the temporalis muscle. It's one of the chewing muscles. So we can take a little bit of the lining of the muscle called the fascia and make an eardrum out of that. The other most popular option is to take a piece of cartilage from around the ear and shave that down as well and use that to rebuild the eardrum. So fascia and cartilage are the two most common things. There are some other graft options, but they're not as commonly used. So as far as incisions, sometimes we can do the entire procedure inside the ear canal. And so there's always going to be an incision inside the ear canal for eardrum surgery. That incision is not externally visible, so the patient does not see it. So some people think that they didn't have surgery, but trust me, we do the surgery. We can just do it on the inside without making an external incision sometimes. Now, the traditional approach is to make an incision behind the ear. So what we do for that is we lift the ear up and kind of pull it forward. We make the incision behind the ear. That allows us to kind of lift the ear forward, kind of lift it out of the way, so we can come in from the backside. This gives the surgeon access here to the bone behind the ear, which is the mastoid bone. So if we're going to do a mastoid procedure, we have to make this incision behind the ear to get to this bone. There's another way that does not involve an incision behind the ear that we commonly refer to as the endoscopic technique, because we use an endoscope, which is like a camera with a long telescope attached to it. Sometimes the surgeon can do an eardrum repair surgery with the endoscopic technique that does not involve an incision behind the ear. It's less invasive and there's lots of benefits to it, but it's not suited for all patients because it can't access all areas of the ear. If we do make an incision behind the ear like this, like I said, if we do that, we'll place stitches at the end. These stitches are very fine, very small, and they will dissolve. And then I will often add a little bit of skin glue or skin adhesive on top of that to help the healing process along. If you want to watch some videos of some of the ways we do this, I have some videos on my YouTube page. Again, it's Neil Jackson, MD, ear specialist on YouTube. Eardrum healing, this is really important. Eardrum healing rates are very high, like 90%, so pretty good. But the healing is very complex and it takes a long time. We're talking like 2 to 3 months. So it's a very long time for this to heal. And what has to happen is for the graft or the patch to heal to the tissue around it. and so that just takes time. We usually will have multiple checkups in the office after surgery to check on the healing, and there are some strict precautions that the patient must do after surgery. The two biggest ones are no water in the ear for about 2 to 3 months, and limited activity like light activity for 2 weeks. I actually have a whole video dedicated to the restrictions and instructions after ear surgery. Again, that's on my YouTube page. I would encourage you to check it out. The instructions are also typed up in Word format on my website under the top tab for instructions after surgery. As I mentioned, 2 other potential parts of a procedure in addition to an eardrum repair would be ossicular chain reconstruction, which is rebuilding the bones of hearing, and mastoidectomy, which is cleaning out that honeycomb of bone behind the ear. So again, the ossicles, these are actually the smallest bones in the body, and they form a little chain, or like a little bridge between the 3 bones, and so they're linked together. And so anything that disrupts that link or disrupts their ability to sort of move can cause a type of hearing loss that we call conductive hearing loss. This is really a mechanical problem, and usually we can repair this in the operating room with a mechanical fix. There's many ways to do that. It kind of depends on which bone is affected and how it's affected. I have some examples of this on my YouTube page as well. There's a few videos. Again, you can look me up. It's Neil Jackson, MD, ear specialist on YouTube. And finally, the mastoid procedure. So I've outlined here in red, this is the mastoid bone. It's not solid bone typically. It's usually more like a honeycomb of bone. And so this is a common place for infection or inflammation to build up inside the ear. And as you can see, it's right next to the eardrum. So if a patient has had a hole in the eardrum, they've had a bunch of infections kind of going in and out through the hole, it's very common for them to spread to the mastoid bone. So if we're repairing a hole in the eardrum and there's been a lot of infection, we will often address the mastoid at the same time. What that means is that we do something like this. So this is a mastoidectomy. So again, we've made an incision behind the ear, and we've located the mastoid bone behind the ear. This is the ear canal seen here. And essentially, we're just going to open up all these little bitty pockets. As you see here, this patient has a lot of infection and inflammation in these little pockets, these little air cells. And so we're just going to open these up with our drill until everything is essentially open and clear. And that allows us to really wash it out. So here we are towards the end of the mastoid procedure. We're able to kind of flush out all the infection, helps us really get it under much better control. So that's the mastoidectomy. So again, in summary, I would say that the ear has a lot of small, tiny, and delicate structures. These are prone to injury. Infections and injuries can cause permanent damage, like a hole in the eardrum or weakening of the bones of hearing, and thus hearing loss. The surgical options that we talked about today include tympanoplasty to rebuild the bones, or to rebuild the eardrum, ossicular chain reconstruction to rebuild the bones of hearing, and mastoidectomy to clear out the mastoid bone from any infection or inflammation. There are some important restrictions after surgery, but again, the large majority of patients are able to comply with those and get a lot of improvement from the surgery. If you have any questions, please remember this is general information, and you should consult with your local doctor for the best advice for you. Thank you.